I have an entire ICU up here with 24 beds. Where you are at is a COVID ICU. We have another ICU that's not COVID. We have 2 full med-surg units that are all full of COVID patients. Those have 25 or 30 on them. And each unit has 25 or 30 patients on it, so it's a good 75 to 80 patients we have in-house today at varying levels of care, and they're constantly moving.
With COVID, it's oxygenation. We want to keep your O2 sats high, 88 or above. So when the patient drops, we have to give them supplemental oxygen. So we have a mask that goes over your nose and your mouth that does positive pressure, keeps your lungs open, delivers oxygen. And then that high flow nasal cannula kind of does the same thing, but through your nose. And then in the end, if all of that doesn't work, our last step is to place you on the ventilator, which is literally like a garden hose down your throat, and we breathe for you.
I don't know how to deal with it because I've never had to deal with it for this long of a time period. We've been doing this since March. So every single nurse, I would have to say, every single nurse that I work with right now is emotionally and physically and mentally exhausted. I think we all cry at least once a day.
We have brought in agency nurses. We have different programs to incentivize people, as well as always trying to get additional staff in. And then we have within our disaster plans, some escalating things where we would go in and ask the community for any assistance with people who maybe are no longer in practice, nurses returning to practice type things. So multiple layers of disaster planning depending on where we go from here.
Growing up here in Oklahoma, I've born and raised here. You see the community come together on tornadoes, the Murrah bombing, any ice storm. You see us coming together and responding to other parts of the country. And right now, our hospitals are begging for help. And I feel like the community does not see that. And I don't think they realize that, the coronavirus is bad and it's here. It's a virus like we've never seen before. It's not just like the flu. And it's not just affecting older people. We can see ourselves in those patients. We can see our mom, we can see our sister, we can see our neighbors, our family being in that position. We're one step away, and it's real.
You can be asymptomatic and be spreading this virus around without knowing it. And you can be walking around, living your life, pretending like none of this is real. And you can give this virus to someone who is immunocompromised or who is older, and you can kill them. And you may not know it ever happened, but we know that it happened, and we are here with them when they die. We are holding their hand. We are holding the Zoom and letting their family talk to them. And our hopes in this is if we can't get you as the public to care about each other, that maybe we can get you guys to care about us. We've been caring for Oklahomans. We've dedicated our lives to this and our career to this, and now we need the public to care about us, because this is not sustainable.